Dear viewers, when we talk about liposuction surgery, I would like you to specifically understand that we should perform liposuction as a body contouring surgery, and please accept it in this way. Liposuction, meaning the surgery of removing or aspirating fat from the body, should not be done for the purpose of losing weight. It is incorrect, unhealthy, and lacks aesthetic appeal. So today I am going to discuss body contouring procedures using liposuction with you. In theory, there are three distinct methods we can utilize for liposuction surgery. The first is the classic super wet technique for liposuction, and the second is the laser-assisted liposuction procedure. Liposuction, and third, Vaser liposuction. Basically, the result achieved in all three is the same. It is the contouring of the body. It is only the specific apparatus, the techniques, and the surgical methods employed that differ. In our clinic specifically, we utilize all three of these methods, including the classic super wet technique, laser liposuction, or Vaser liposuction. You can have this surgery. When performing this surgery and these applications, your examination findings are very important. Your desires, requests, and expectations are very important. This is because we will choose the technique to be used together based on these factors. Regardless, during liposuction, we will perform contouring by removing an amount of fat tissue from your body that will not harm your health or put your health at risk. Basically, these can be the abdominal area, the stomach area, or the sides of the waist. Particularly for women, the hip area, the inner thigh area, or the inner knee area are the areas where we most frequently apply liposuction surgery. Regardless of the method used, once we have completed this surgery, we will put on your corset while you are still in the operating room. We will finish the surgery by putting on your corset while you are asleep. I usually want my patients to use these compressive garments, these corsets, for 3 to 4 weeks. After using it for 3 to 4 weeks, we will gradually stop using the corset by increasing the time our body stays without the corset. For liposuction to reach its final result, that is the time required for the tissues to completely adhere inside while you are not wearing a corset, and for you to reach your thinnest possible state, is about 1.5 to 2 months. Naturally, your edema will gradually subside. The tissue will slowly begin to adhere inward. However, for example, I can recommend this to a patient who will have this type of surgery. Photograph yourself once every week. You can also see this thinning very clearly in the weekly photos. The patient may be discharged on the very same day following this surgery, or we can discharge them the following day. Approximately 1 week to 10 days after the surgery, you may begin sports activities and exercises, and you can gradually increase their frequency. And in any case, as I mentioned before, after 3 to 4 weeks of corset use, and within 1.5 to 2 months, you will achieve your final result and continue your life in an incredibly slim and fit condition.